government assure modern commitment to adequate health care service delivery. Plus, stakeholders in Zamfara State advocate for improved budgetary allocation to health sector. Good evening, viewers. Welcome to NTA Gusau. Today, 17 Ramadan 1447, after the hijrah of Prophet Muhammad from Mecca to Medina, which is equivalent to 6th March 2026. With me, Ilyas Allah, is the full details of the news. The Federal Executive Council has approved the implementation of new exit benefit scheme for federal civil servants, granting retiring officers a gratuity equivalent to 100% of their total annual emolument. This is contained in a statement signed by the Director of Press and Public Relations in the Office of the Head of the Civil Service of the Federation, Mrs. Eno Oluto. According to the statement, the scheme, which takes effect from the 1st of January 2026, is aimed at strengthening the welfare of civil servants and ensuring that officers who have served the nation for a minimum of 10 years retire with dignity and financial security. The approval followed extensive deliberation by an Ministerial Technical Committee set up by the Office of the Head of the Civil Service of the Federation, working in collaboration with the National Pension Commission, the Budget Office of Federation, and the Office of the Accountant General of the Federation. The statement explained that the scheme is designed to complement the existing contributory pension scheme by providing an additional financial safety net for civil servants in Treasury-funded ministries, departments, and agencies. Head of the Civil Service of the Federation, Mrs. Didi Esther Wilson-Jack, described the approval as a landmark decision that demonstrates the federal government's commitment to the welfare of civil servants and recognition of their contributions to national development. She added that detailed guidelines for the implementation of the scheme will be communicated in due course. The Deputy Governor of Zamfara State and Chairman State Primary Health Care Standing Committee, Mani Malam Mumuni, has reiterated the commitment of the state government to strengthening the primary health care services and improving immunization coverage across the state. The Deputy Governor made this known in his opening remarks at the monthly meeting of the Zamfara State Standing Committee on Primary Health Care System Health in Gusau. Correspondent Abdul Hakim Ahmad Yaqub has more.
The Deputy Governor emphasized the importance of immunization in safeguarding the health of citizens, particularly children, noting that vaccination remains one of the most cost-effective health interventions for preventing disease that continue to threaten communities. Mani Momoni acknowledged that Zamfara State has faced several public health challenges over the years, including maternal and child mortality, malnutrition, and vaccine-preventable disease, which have placed considerable pressure on the healthcare system. However, he commended the effort of health workers, development partners, and members of the State Task Force Committee on Primary Health Care for their dedication and achievement. He particularly congratulated the committee for the successful leading of Northwest Region in the National Primary Health Care Leadership Challenge 2025.
We must commend the efforts made by the state government, our health workers, our development partners, and above all the state's Task Force Committee on Primary Health Care System for successfully leading the Northwest Region in the National PHC Leadership Challenge 2025.
He also used the opportunity to inform the stakeholders and general public about the upcoming full vaccination exercise tagged the Ramadan March campaign, during which over 1.3 million eligible children across the state are expected to receive the vaccine. Commissioner for Health Nafisa Muhammad Maradun called on critical stakeholders to ensure monitoring and evaluation mechanisms are put in place for the vaccines to reach the targeted beneficiaries.
This is all thanks to your leadership and commitment. Even though we have some few challenges, particularly the rising polio cases we are having in the state, especially in local government and state government.
She appreciated the commitment and contribution of members of the committee and development partners towards strengthening the state health care system. In Gusau, Abdul Hakim Ahmad Yaqub, NTA News.
Wife of the Zamfara State Governor, Hajia Huriya Dauda Lawal, has donated assorted food items to security agencies, civil servants, non-governmental and civil service organizations in the state. The initiative is part of the present administration's commitment to improving the general well-being of the people, especially during the holy month of Ramadan. Correspondent Murtala Bala Gusau has more.
More than 3,000 bags of assorted food items were distributed to security agencies, civil servants, as well as non-governmental and civil society organizations by wife of the Zamfara State Governor Hajia Huriya Dauda Lawal. The items donated include rice, beans, maize, millet, sugar, groundnut oil and wrappers. Flagging off the distribution, the governor's wife, represented by her senior special assistant on women mobilization, Hajia Hadiza Abubakar, said the initiative forms part of the present administration's commitment to improving the welfare of the people. Some beneficiaries of the gesture, who expressed excitement, appreciated wife of the state governor for the support.
We really appreciate Huriya Dauda Lawandari. May Allah guide her and protect her.
We thank him very much for this privilege to have this food.
We pray that God Almighty will bless them abundantly.
With this development, more than 50,000 people across the state have benefited from the Ramadan welfare package provided by wife of the state governor. In Gusau, Murtala Bala, NTA News.
Stakeholders have been suggested to increase investment in nutrition to address the rising cases of malnutrition in Zamfara State. The suggestion was made during a one-day state-level media dialogue and stakeholders engagement held in Gusau. The report.
The one-day state-level media dialogue and stakeholder engagement focus on Child Nutrition Fund and the implementation of 6 months paid maternity leave in Zamfara State as part of efforts to improve maternal and child nutrition. According to the civil society scaling of nutrition in Nigeria, findings from the 2023 National Demographic and Health Survey shows that stunting among children in the state has increased from 50.8% in 2018 to 64.2%, while underweight cases stand at 44.3%. The report also indicates that 84% of children under 5 and 35.6% of the women of the reproductive age suffered from anemia, and attributed the situation to food security, displacement caused by insecurity, low inclusive breastfeeding rates, and limited access to skilled maternal health care services.
Evidence consistently shows that malnutrition weakens human capital. It reduces lifetime earnings and drains up to 11% of gross domestic product in high-burden countries. Timely investments in maternal, infant, and young child nutrition, particularly during the first 1,000 days of life, yield.
The organization called on Zamfara state government to allocate at least 0.5% of the state budget to nutrition programs and ensure effective implementation of the state multi-sectoral plan of action for nutrition.
We advocate for ring fence and increased nutrition budgets across the health, agriculture, education, water and sanitation, and social protection sectors enroll in CNF, the Child Nutrition Fund, and ensure practicable and timely fund releases.
It also urged media, private sector, and civil society organizations to support efforts aimed at improving nutrition and safeguarding state economic future. In Gusau, Bello Sani Maradu, NTA News.
Stakeholders in livestock production have reconvened in Sokoto review and validate resolutions reached during earlier engagements with the Minister of Livestock Development. The focus is to assess possible implementation challenges addressing key concerns with the livestock value chain and strengthen collaboration among stakeholders in line with the federal government policy on livestock development. Bello Sani reports.
The engagement brought together crop farmers, cattle rearers, poultry producers, medical and veterinary doctors, as well as representatives of the Sokoto State government and other critical actors in the livestock value chain.
Of course, grievance cannot be ruled out in every community.
The participatory session focused on validating data generated during the earlier focus group discussions and reviewing post-engagement experiences to assess progress and emerging concerns.
Of course, as we continue the validation, you will see clear part of how they should be engaged and what they should do to make sure the grievance part of it is strongly enhanced for mutual business benefits for all the actors in this livestock sector.
As a key stakeholder, the Sokoto State government reiterated its pivotal role in addressing the multifaceted challenges confronting the livestock sector, particularly in the areas of resource management, infrastructure, and intergroup relations.
We have to control how they get the water so that they don't go into the dams straight in and cause havoc in terms of the health aspect.
Everything we are doing is just in alignment with that, filling that gap. And I think this particular project is really aligned with our 9-point SMART agenda, particularly in the agri sector. So all we need to do is just to make sure we are tracking performance and we are adding those performance in trying to fill that gap.
We have established water points across the state, like 30 boreholes across headers communities.
Participants expressed optimism that the inclusive and evidence-based approach would facilitate practical solutions capable of meeting the set objectives.
And then we may put some measures in order to punish anybody involved in those conflicts. And this will go a long way in providing peace, progress, in having more livestock for us to feed and in boosting our economy.
And engaging the network of persons with disability so that we should not left behind. Person with disability, like any other citizen, we have a role to play.
Stakeholders maintained that previously identified challenges are expected to be addressed through the sustained dialogue, shared responsibility, and actionable commitments from all parties involved. In the Sokoto, Ali Muhammad Kawai, NTA News.
Viewers, we are sorry for the mix-up in this report. The report was brought to you by Ali Muhammad Kawai, not Bello Sani, as earlier said. Thank you. As the holy month of Ramadan continues, experts in Zamfara State have continued to warn patients against negative effects of ulcer while observing fast. They gave the advice in separate interviews with NTA News. Correspondent Zainab Sani Shaibu reports.
Medical experts say fasting for long hours without food or water can increase stomach acid, which may worsen ulcer symptoms such as burning pain in the abdomen and general discomfort. A medical expert at the Federal Medical Center Gusau, Dr. Munir Muhammad Sidi, advised patients with chronic ulcer to avoid observing fasting due to the potential health risks it may pose to their body system.
They are advised to take drugs called proton pump inhibitors. and also proton-pump inhibitors like omeprazole, pantoprazole.
A nutritionist, Dr. Nafisa Sani, recommends that ulcer patients who are able to fast should break their fast with light and easy digestible foods such as fruits, dates, and warm meals, rather than heavy meals that may trigger stomach discomfort.
We should try and restrain from taking all these heavy fried foods because they are very, very difficult to digest. It's like a norms, like a culture that during Ramadan you fry things. People do it, but it's not advisable.
Also speaking, an Islamic scholar in the state, Malam Abdul Hakim Ahmad Yaqub, explains that Islam permits individuals with serious health conditions, such as ulcer, to stop fasting if it may endanger their health.
But when somebody feels that he cannot perform the fasting during fasting because he's not well, easy like ulcer and any other related diseases that will stop him from doing the fasting, then he can count the days, eat, drink, and take medication. Then after the fasting, when we make up the fasting.
Health practitioners also called on ulcer patients to avoid taking milk during ulcer attack, noting that it contains fat which may aggravate the condition. In Gusau, Zainab San Shaibu, NTA News.
Viewers, with this report we conclude our news tonight. Thanks for watching. Good night.